A deadly virus is spreading once again in Central Africa. The WHO has now declared the recent Ebola outbreak in the Democratic Republic of Congo and Uganda a global health emergency. With dozens dead, hundreds of suspected cases, and no approved vaccine for this strain, the world is watching closely. The outbreak began in the Ituri province of Democratic Republic of Congo, near the border with Uganda. According to the African CDC and WHO reports, more than 240 suspected cases and over 65 deaths have already been recorded. Health officials say the outbreak involves the rare Bundibugyo strain of Ebola, a strain for which there are currently no approved vaccines or targeted treatments. Cases have now reached urban centers, including Uganda's capital Kampala, increasing fears of wider regional spread. Now, let us understand what is Ebola virus. Ebola is a severe and often fatal viral disease. It spreads through direct contact with infected bodily fluids, contaminated surfaces, or infected animals. Symptoms usually begin suddenly and may include fever, weakness, vomiting, diarrhea, muscle pain, and internal bleeding. Depending on the strain and healthcare access, Ebola can have fatality rates ranging from 25% to as high as 90%. Ebola says that experts now say that this Ebola is especially dangerous for several reasons. First, the affected region face armed conflict, weak healthcare systems, and population displacement, making containment difficult. Second, officials believe the virus may have been spreading undetected for weeks before the outbreak was confirmed. And finally, because this is not the more common Zaire strain, many existing vaccines may not be effective. The WHO have declared the outbreak as a public health emergency of international concerns, its highest alert level for global health threats. Rapid response teams have been deployed, isolation centers established, and cross-border monitoring intensified. Despite the emergency declaration, health experts says this is not currently considered as a pandemic. For now, the world's focus is on containing the outbreak before it spreads further. Public health experts stress that early detection, isolation, safe burials, and international cooperations are critical to stop Ebola. As scientists race to understand this outbreak, one thing is clear: the lessons learned from past epidemics are once again being tested. So, this was about Ebola outbreak, the recent one which is happening now. If you liked my video, then please subscribe to my channel and follow for more health related updates. Stay safe.